9 ways to relieve acid reflux without medication. A few lifestyle changes are worth trying before resorting to drugs for controlling gastroesophageal reflux. If you're sounding a little hoarse and have a sore throat, you may be bracing for a cold or a bout of the flu. But if you've had these symptoms for a while, they might be caused not by a virus, but by a valve, your lower esophageal sphincter. That's the muscle that controls the passage between the esophagus and stomach. And when it doesn't close completely, stomach acid and food flow back into the esophagus. The medical term for this process is gastroesophageal reflux. The backward flow of acid is called acid reflux. Acid reflux can cause sore throats or hoarseness and may literally leave a bad taste in your mouth. When acid reflux produces chronic symptoms, it is known as gastroesophageal reflux disorder, or GERD. The most common symptom of GERD is heartburn, pain in the upper abdomen and chest that sometimes feel like you're having a heart attack. 3 conditions: poor clearance of food or acid from the esophagus, too much acid in the stomach, and delayed stomach emptying contribute to acid reflux, says Dr. Jacqueline Wolf, a gastroenterologist, an associate professor of medicine at Harvard Medical School, and author of A Woman's Guide to Healthy Stomach, taking control of your digestive health. If you've been having repeated episodes of heartburn or any other symptom of acid reflux, you might try the following. Number 1. When the stomach is very full, there can be more reflux in the esophagus. If it fits into your schedule, you may want to try what is sometimes called grazing, eating small meals more frequent rather than 3 large meals daily. Number 2. Avoid certain foods. Acid reflux were once instructed to eliminate all but the blandest foods from their diets, but that's no longer the case. We have symptoms of days when we couldn't eat anything, Dr. Wolf says, but there are still some foods that are more likely than others to trigger, including mint, fatty foods, spicy foods, tomatoes, onions, garlic, coffee, tea, and chocolate, and alcohol. If you eat any of these foods regularly, you may try eliminating them to see if doing so controls your reflux, and then try adding them back one by one. The Foodison Health website at www.foodicinehealth.org has diet tips for people with acid reflux and GERD, as well as other gastrointestinal disorders. Number 3, don't drink carbonated beverages. They make you burp, which sends acid to the esophagus. Drink flat water instead of sparkling water. Number 4, stay up after eating. When you're standing or even sitting, gravity alone helps keep acids in the stomach where it belongs. Finish eating 3 hours before you go to bed. This means no naps after lunch and no late suppers or midnight snacks. Number 5, don't move too fast. Avoid vigorous exercise for a couple of hours after eating. An after-hour dinner stroll is fine, but a more strenuous workout, especially if it involves bending over, can send acid into your esophagus. Number 6, sleep on an incline. Ideally, your head should be 6 to 8 inches higher than your feet. You can achieve this by using extra tall bed risers on the legs supporting the head of the bed. If your sleeping partner objects to this change, try using a foam wedge support for your upper body. Don't try to create a wedge by stacking pillows. They won't provide the uniform support you need. Number 7, lose weight if it is advised. Now that is a really highlighted point that should be addressed. Nicotine may relax the lower esophageal sphincter. Number 9, check your medications, some including postmenopausal estrogen. Antidepressants and anti-inflammatory painkillers can relax the sphincter, while others, like Fosamax, Moniva, Actonel, which are taken to increase bone density, can irritate the esophagus. If these steps aren't effective, or if you have severe pain or difficulty swallowing, see your doctor to rule out other causes. You may also need medication to control reflux even as you pursue lifestyle changes. I hope some of this information will help you in one form or fashion. If we have done a very good job of this, or if you enjoyed the video, please hit the like and subscribe button below. Thanks for watching.